Dexa scan. It's a dual energy X-ray absorptiometry. It is used of X-ray of different energies to calculate bone mineral density measured at kilogram per meter square. How is it produced? Two X-ray beams, AP of the femur and the lateral of the lumbar spine, and use them to measure BMD. Then you compare it to the patient with peak BMD, that is sex and race match T-score, useful to calculate osteoporosis risk in individual of same sex, age and race match Z-score, more better for looking metabolic bone diseases. Use calculating osteoporosis risk in individual who have fragility fractures. Defining osteoporosis, T-score of less than 2.5, standard deviation below the peak BMD in a 30 years old individual. Osteopenia -1 to -1.5. Severe osteoporosis less than -2.5 plus fragility fractures. Number 2, fracture risk assessment score. You can calculate fracture risk assessment score by adding up the other factors. It is an online tool. Number 3, monitor individual with metabolic bone disease with response to treatment. Advantages: calculating osteoporosis risk, calculating BMD. Disadvantages: ionizing radiations, form of X-ray, and required precautions, time, distance, and shielding.